public involvement in research, the what, why, and the how. I'm going to be taking the first two relatively easy bits, which is the what is patient and public involvement, and why do we do it? And Katie is going to be taking the much more difficult how we actually do it. I'm not daft, Katie. So what is patient and public involvement? Some of you, I'm sure, will be very much aware of this, but for others, this will be quite a new thing. And what we tend to do is distinguish between involvement and participation. So by involvement, we mean research being carried out with or by members of the public rather than to, about, or for them. So this is, for example, patients, members of the public being involved in development of a research proposal, designing your research or helping you design your research instruments, sitting on steering committees, for example. And this, of course, is distinct from participation. And this is where people take part in a research study. This is where you collect data from participants in your research study, for example, clinical trials, completing questionnaires. It's also worth, I think, reflecting on who do we mean by the public. And this is the involved definition from 2012. I'll just read this out. When using the term public, we include patients, potential patients, carers and people who use health and social care services, as well as people from organisations that represent people who use services. And I think that's clear. And it's the second one that sometimes causes some issues. Whilst all of us are actual former or indeed potential users of health and social care services, there is an important distinction to be made between the perspectives of the public and the perspectives of people who have a professional role in health and social care services. And this second sentence is really there to prevent or discourage, rather, researchers from simply asking their peer group, if you like, the people that sit next to them, to be involved in their research, rather than actually try to involve people from the wider community. But we do, of course, have to adopt a very common sense approach to this. For example, a clinical researcher with type 1 diabetes still wakes up every day as a diabetic. So we do have to adopt a common sense approach here. But what you really want is a diversity of perspectives in your research. There are many different approaches to patient and public involvement in research. And I've got 4 listed here: consultation, collaboration, co-production, and patient or user-controlled research. And I'll just take you briefly through each of these to try and distinguish between them. And the way that I distinguish between them is to think about it in terms of the power that members of the public might have in decision-making in your research. So let's take consultation. So here, for example, you might be developing a research questionnaire. And you might consult with members of the public about your research questionnaire, but there's no real shift in power, because it would be up to you as the researcher whether or not you took on board their views. I'm not saying that's necessarily a bad thing, but that's what consultation is about. When we talk about collaboration, this is much more of a partnership. So here, the voice of the public carries equal weight to other people around the table, yourself and anyone else, any other health or social care professionals. So taking our questionnaire example, you would jointly develop the questionnaire. So there's a real shift in power there. In co-production, I mean, we could do a whole session on co-production, but we won't, of course. And I think the way of distinguishing this between consultation and collaboration is in consultation and collaboration, it's still very much about the researcher determining which parts of the research require public involvement. And in co-production, it's much more about joint ownership of key decisions. And so the whole group would decide in which areas of the research they would be involved in and who is responsible for what. And then finally, of course, we have patient or user-controlled research. And this is research that's pretty much run by patients and service users, and it's they who determine which elements researchers, for example, might be involved in. Now, in practice, of course, there's blurred boundaries between all of these, and it's rarely do you often, you find such completely consultation or completely collaboration. And indeed, in my own experience, that I've often started trying to collaborate, but if I was being brutally honest, it's ended up more like a consultation, but sometimes vice versa as well. And of course, you can combine these approaches within one project. So for example, it might be that you want to consult on the development of your design of your questionnaire, but it might be that you have public members on a steering committee. So it's a much more collaborative aspect. But I do think looking at it like this can be quite a useful analytical tool for helping to think about what kind of involvement is most appropriate for your project. And I think having that clarity is very, very useful. If you can get that clarity from the beginning, I think it'd be very, very helpful. And I'm sure we'll touch on that again later on. So that's the what is patient involvement. Now we come on to the why. And I'm going to take you through 4 key reasons as to why you should do patient involvement. The first reason is that patients and public offer a different perspective from the rest of the research team. They will have expertise in their lived experience of a particular service or a condition. And I would argue that that is equally as important as other members of the research team that might have research experience or professional knowledge of a service. It's just different. And they're going to know about the impact that changes in the service or perhaps their drug regime. They're going to know the impact that's going to have, for example, on their quality of life. And they can use this knowledge and this lived experience to improve the research quality and the relevance of the research. They can make sure that your research focuses on issues of relevance to them. They can help improve research instruments, for example, making sure the questions in your questionnaire can be understood. Your interview questions focus on key issues and are comprehensible to members of the public. And similarly, of course, they can help you with your recruitment procedures and all the documentation that surrounds recruitment and making sure it's legible, etc. We then come on to the third reason, the moral imperative. And this is a very personal view, but this is the one that's, for me, is the most important one. And it's simply that I think people should have involvement, they should have a say in decisions and research that will impact upon them. It's the fundamental principle for me, and it's a very personal view, but that's the most important one. So I've given you 3 reasons there: the different perspective, the potential to improve the research quality, and the relevance and the moral imperative. And I really hope that you could embrace at least one of those reasons, because I do think it will make your involvement more meaningful. I think it will make it easier, and I think it will make it more fun if you can embrace that. However, if you can't, then I come to my 4th reason, and it's simply that you have to do it. It's increasingly becoming a standard for research, and it's something you'll have to do for the research element of your fellowship. And here at the National Institute for Health Research, and this is applies for any funding around research, National Institute for Health Research, we expect the active involvement of members of the public in the research that we fund. We recognise that the nature and extent of active public involvement is likely to vary depending on the context of each study or each award. And I can show you that when it comes to your interview panels for fellowships, there will be public members on it there. And any documentation that you complete that involves patient and public involvement will be assessed, and they will be looking for good patient and public involvement. So when should we involve members of the public? It's very easy to say we've got to involve them. When should we? Here is the research cycle that some of you may be familiar with. And the simple answer to that question is as early as possible. So of course, if you look at the identifying and prioritising and commissioning, that's very much something that the funding body deals with. But of course, you can involve the public in the design, for example, of your research proposal, possibly the management as well, for example, in steering committees and advisory groups. You can also involve members of the public in undertaking your research, designing your research instruments, for example, and indeed perhaps helping you collect data, and of course dissemination, implementation, and evaluating your impact. So that's very much the what and the why of patient in public involvement. And I'm going to hand over to Katie now, and I'll be doing Katie for the how.
Thank you, Gary. Thank you. Hello, everybody. So, thought it would be helpful to use what are called the UK standards for public involvement to sort of provide a framework for this part of our presentation. These standards were developed around 3 years ago by a UK-wide partnership. They were designed to encourage reflection and help researchers, members of research teams, evaluate alongside the progress of the research what's going well and what lessons can be learned and things changed. Can also be used to help us design, review and assess the involvement that we have in our research. And I just want to stress that these standards are a guide. I'll be taking each standard in turn and saying a few things about them, but certainly those things I'm saying are not exhaustive, but hopefully will provoke some further thoughts and ideas. Next slide, Gary, please. Right, so the first of these standards is inclusive opportunities. Be very clear about who you need to involve, and that's all about matching the experiences of the people you want to involve with the end users of your research project. So target your recruitment so that it reaches the groups that you want to get involved. We have a phrase in involvement, the usual suspects. So sometimes it's very hard to avoid these, even with the best of intentions. When you identify people who've got the right sort of lived experience and who want to be involved, it's difficult not to sort of keep reverting to those people because you've got sort of an established body. But really important to not keep approaching just the same people all of the time. Be fair and transparent in your approach and make sure it's an equitable approach. Identifying and addressing barriers to involvement. So there's all kinds of things there like location, transport, timings of meetings, frequency. Do the people that you're wanting to involve have disabilities or responsibilities around caring or about the other work that they're doing? All good things to know and take into account. Next slide, Gary. Thank you. Working together. Gary referred to this a bit earlier on about hierarchies of knowledge. So I think in order to attempt to achieve working together on a sort of a level playing field, we do need to address these hierarchies of knowledge, which definitely exists in our research world. We can't ignore that or, you know, have it as the elephant in the room, I think. Often there is an assumption that professional or research knowledge sits above the knowledge that is acquired via the lived experience of a condition or services. We like to see them as different but equally important. Also, it's good to be clear about why you're involving people and the expectations you have of them in terms of the role you're asking them to do in your project and the time you're asking them to take. Payment also, very clear, very important to be clear about that. But when you're thinking about all this, please do try and involve the public in these involvement plans to check that, you know, your thoughts about roles and expectations are actually on target. And ensure that public contributors can give feedback and comments throughout the process. Next slide, Gary. So the next standard is around support and learning. Budget. Can't stress how important this is. So that would cover what you're paying people to do. And it's not just, I mean, I feel personally very strongly about this. You're not just asking people to be involved, you're asking them to do a role and a piece of work, and that needs to be recognised as you would recognise any other person working on a research project. So the budget covers payment expenses, which might be things like travel, accommodation, carer responsibilities. And what I found from experience, make sure you have a policy or document which addresses all these practical issues, and make sure it's there at the start of the project. Support. So it's always good to aim to have more than one public or patient representative in your team. And also making sure that support you or other research team members can offer is achievable, and also recognising that there's different types of support that you can offer. So support around people using their research skills, but also support around using their lived experience, and both are equally important, because that's why, you know, we're asking people to get involved with the research because of their lived experience. And just because it is experiential doesn't mean to say we shouldn't give support for that. In fact, it's, you know, equally, if not more important, that we do. Training is another really important part, and identifying the level of knowledge that people are bringing to the project, as opposed to the level which may be needed, and having a clear plan which sets out how you're going to bring those two together. It's often helpful to have a named person responsible for public involvement. And key is learning along the way. Don't be afraid to change things if they're not working. So try and adopt a flexible approach that allows you to adapt to changing circumstances. Next slide, Gary. Communications. So keeping people informed about the project in a way that's suitable for them. So this might be a regular email, it might be a meeting, it might be a newsletter, but ask the people that are involved what works for them. It's not very helpful to just think, oh, okay, I'll bung them an email every month and that'll be it. People need to tell you the way that they, you know, prefer to be informed, and the way that's accessible for them. So think about language issues, whether people have visual impairments, access to email, and always keep an eye on using the language that you use. And keep people very informed about the value of their contributions and where they've made an impact. This is often an area which gets overlooked or forgotten, especially if you've got quite a tight budget or resources and you're working to quite tight deadlines. Next slide, Gary. Okay, impact. So this isn't necessarily about proving that public involvement works, although you might well get lots of people saying, well, show me the evidence. Prefer to think that it's about improving how we work together, those fundamental principles. And in order to do this, you do need to collect information on what's working and what doesn't work. And really key to collect information over time, minutes of meetings, records of regular feedback, review meetings, and building in perhaps time for reflective spaces at each stage of the research process. So you're able to capture these experiences as they're happening or soon after, rather than looking back, you know, in a retrospective way over what could be months or years. And working with public members on how you're going to evaluate the involvement, how you're going to assess what difference has it made, and definitely something that you should be doing together. Next slide, Gary. Governance. So very necessary, often quite complex, and not the most favourite thing on everyone's list, but really key. So making sure that those people you're involved are really involved in the decisions about the research and the resources needed for the public involvement. So have your systems in place to review what worked and what didn't. And we've already mentioned that you should have a named person in place who's responsible for public involvement. And this individual, you know, could review with public members on a regular basis what's happening and whether it's working. Next slide, Gary. So this is just a slide which I'm not going to really talk about. You'll have these slides. It's really just a resource about where you can find people that you need for your project. Next slides. Thanks, Gary. And I'll just end by quickly going over the top tips. Involvement, try and make that as early as possible. It isn't always possible, but the earlier you involve people, the deeper and more enriched your level of involvement will be. I've already mentioned accessibility, just so important to keep that in mind. Too often, I think we expect people to understand the language and jargon of the research world, rather than recognising, you know, the fact that we need to find different ways of explaining things. Making sure you've got enough resources for public and patient involvement. That involves requiring the thinking and planning far in advance of the project itself. Make sure you build it into your proposal and make sure you have a budget for it. Training and support, very important. I've talked about that earlier. Acknowledging the expertise of the public, recognising this in any of your outputs and making sure you agree how and when this is going to be done. And always, always being very clear about purpose and responsibilities, and that everybody is clear about expectations that are set. That's the end of my part of the presentation. I'll hand over to Gary now.
Thank you very much, Katie. I'm just going to wrap up briefly about how we can help you. So you can basically contact us at the Research Design Service, and we'll provide advice and support on helping you develop your PPI plans. We sometimes can link you with patients and members of the public, and as Katie said, there's a slide there about other ways that you can do that as well. We have a public involvement fund where we can provide small amounts, pots of money to help you with your PPI endeavours. And again, I've got a link to our website on there as well, so you can read a bit more about how you access that and how you're doing it. It is online now. So in terms of summing up, we've talked about the what is patient and public involvement, and in particular, we've distinguished it from participation. We've spoken about the why, the four key rationales, a different perspective patient and public can bring, the potential to improve the research relevance and quality, the moral imperative, and the fact that simply it's the standard and increasingly you have to do it. And then Katie has talked about how you do it, and particularly around the 6 standards, inclusive opportunities, working together, support and learning, communications, impact and governance. And finally, we've spoken a little bit about how the Research Design Service South East can help you. So I hope you found that useful, and obviously over to Anna-Marie now for any questions.
Yeah, does anybody have any questions? I haven't got any in the chat at the moment. One thing I thought I would add just for now is the electronic link to the PIF, Gary, to the involvement fund.
Yes, that's correct. Yes, it's online now, so people can go online and put in an application for the Public Involvement Fund.
And how long does that take to hear back?
Hopefully Julie's online. I think it's 2 weeks. I might be wrong. If Julie's online,
hello. We're trying to get it officially. We say we aim to take within 3 to 4 weeks, but I have been trying to get it back to people in just around 2 weeks now. So we are trying to make it a bit of a faster process, and that's been going okay so far. So we are sort of unofficially trying to get it to people in 2 weeks.
Thanks, Julie.
I just wanted to add as well that we didn't cover that we do have, I think Gary's put the link there to our website, so do take a look, because obviously during these times we've had to take a different approach to PPI, so there's now a lot of guidance on our web pages around how to carry out PPI during these times.
Okay, thank you. And I'll put that link in there as well. So just pop that in the chat box. Hand over to you, Claire.
Okay, brilliant. Thank you so much. So now we'll have a 5-minute comfort break and we'll come back for our final parallel session where we're hearing from panel members. So see you in 5 minutes.
Thank you.